the numbers evening out. Thanks for letting me know.
All right.
So good morning, everyone. My name is Teresa Vanderbent. I am with MnCHOICES Training. Welcome to the revised MnCHOICES Application Launch Webinar Launch Overview that's set for today, Wednesday, September 14th. I will go ahead and get us started. So this is a list of the MnCHOICES team, the people that may be attending with me today. I believe we have most, if not everyone, on this list. With the change in WebEx, it's harder for me to see who's all here, but I've heard most of their voices this morning. And it also then gives you a chance to see who we represent inside DHS, specifically inside Aging and DSD. So this session is recorded. You heard me say that if we're at the top of the hour talking to Alan about turning the recording on. Disability Services Training Archive webpage and under the MnCHOICES heading. And so what you'll see there is at some point the PowerPoint will be posted and a YouTube recording that will include both the visual, audio, and closed captioning for people to use. And so I just want you to be aware of kind of that new process that we have in place. When it's time for you to ask questions, we'll have you use the WebEx raise your hand icon. And you'll raise your hand there, and then we will then call on you. We'll try to call on you in the order that you raise your hand. And then when we call on you, we will unmute you. And so we'll say, yep, go ahead. So you can pretty much assume if we call on you, you can go ahead and get started talking. So just so you kind of know how that's going to work today. So our objectives for these webinars coming up to the launch are really to understand and communicate the release schedule and content management changes. So understanding kind of where MnCHOICES is as an application and the releases and things that are happening to it. That's what content management changes means, so that it's ready to go for you at launch. You're going to learn about the tools in the application to complete your work in the field. We're going to look at workflow and handoffs. We're going to apply knowledge of the application functioning to kind of help inform workflow plans so that you guys can kind of make decisions, because I know that's one of the big picture pieces you're wondering about. And then we're going to work on talking through that transition timeline from using historical documents or your current paper documents to then transition to working completely and fully in the revised MnCHOICES application. That one will happen closer to launch, but it is something that we are committed to talking through with you and give you time to ask questions. And then, of course, we're going to update staff data to implement user access, and we're going to have that conversation today. So I have put these terms on this slide because you may hear me use them in context of where we're going today, and I just want you to be aware of what they mean. When we talk about launch, we mean the day that the revised MnCHOICES application is available to your agency to use to complete your assessments and then support planning work. So it's the day that it's turned on, the production site is turned on, and your staff can log in and begin work. That's officially the launch, or sometimes you'll hear us call it the go live date, the date the switch gets turned on and you can use the application. You may also hear us talk about requirements, and these are just a collection of decisions about the computer system for some reason may not be functioning as we had the requirements were set, and then they get put on a schedule to be later reviewed, prioritized, and potentially fixed. And then lastly, something that for folks who have been around a bit, current functionality and enhancements is kind of our new version of known issues. It's a little more in depth in that it really looks at the defects or changes or enhancements that are coming, that are on the schedule for later to be worked on, and to give you the workarounds while we're waiting for those release changes. We will also add defects to it as well, so it'll become current functionality enhancements and defects document. But for right now, it exists in the Help Center just as current functionality and enhancements. So you can go out and look at it in the training zone right now, and it has that name on it. So our agenda today is really twofold, trying to keep it simple and keep us on what we need to do for today. So we're going to talk through the launch timeline. We're going to look at dates and transition periods, kind of the webinar schedule, and my kind of proposed topics, and then training plan, just kind of the basics, big picture, not down into the details, but just to give you a sense of kind of how this all goes together. And then we'll talk about when the historical documents are going to be loaded to the system. And we're going to spend quite a bit of time today on onboarding, because I know you guys have been asking a lot of questions about when do you get to update those onboarding access request sheets. And so this will be a chance to have that conversation today and kind of tell you what you're going to see and what you're going to get and how we proceed forward. So that's my plan for today. So launch timeline overview. We're looking at the St. Croix River, and we're getting ready to launch our kayaks to start thinking about our launch process with the revised MnCHOICES application. So our launch date, what you've seen in communication, is April the 3rd. You'll sometimes see, I think the date March 31st, it's the day the system will be turned on, but you'll start using it as of April 3rd. You'll have a transition period of 3 months, April 3rd to June 30th, where you'll be completing your work in old systems or on paper, and then you'll transition completely to using the revised MnCHOICES application. And we'll talk more about what that transition looks like later. And then on the day of the launch, you'll be able to complete any new health risk assessments, MnCHOICES assessments, and then later their associated plans in the revised MnCHOICES application. The MnCHOICES assessment or MNA application and the MnCHOICES support plan, MnSP application, so those two computer applications that agencies are currently using, will remain active through June 30th, 2023. And we're thinking that will give time for agency staff to complete their work and close their work in those two systems. So I'm going to just walk through what I'm thinking about for the webinar launch schedule. And the reason why I'm walking you through this, and it really is proposed at this time, is to give you a sense of making sure we're going to meet those objectives that I showed you, as well as to give you a sense of when they will be. If, for instance, when you look at this launch schedule, you think, gosh, I would rather this one was before that one, I am open to that feedback, and I would recommend that you put that in a help desk form with a note on it for me that just says, gosh, I didn't see this in the webinar. And the topic, you can see the 12th. My thought is to look at onboarding workflow, and I'm reminding you that when we get there, we'll see the onboarding spreadsheets are going to be due. Candy Oak, I was kind enough to let me know November 11th is Veterans Day, so I will have to move this date. I will send you out a notice that it is being moved, and we will adjust the train link registration for the date rather than getting rid of that. I'm hoping that rather than getting rid of that registration, we can just change the date and notify you that the date has been changed. But we'll stay with the same time. I was thinking going to the 18th if that works. So in that webinar, I'm looking at kind of going through and talking a little bit more in depth about the training plan, kind of the release schedule, like when do these releases happen, and talking through the current functionality enhancements and defects document in a little more depth so you know what's out there and what that's going to mean. And my reason for doing that is just to make sure mentors are ready as they get ready to train. And then December the 12th, we're looking at form functionality and talking kind of through how data moves over from one form to the next, just to make sure that you understand and can see that and know how to look at it and look for it, kind of taking your basic knowledge about the application and making it a little deeper. Then in January is when I thought we would start talking about the 90-day transition timeline and kind of talk through the expectations for counties, tribal nations, and managed care organizations in the different ways that you are doing your work so that you have a clear understanding of where you're heading and what that looks like and time enough to think that through to implement it. And then on February 2023, we will be looking at a pre-launch webinar, and we will leave that topic open in case there are topics that as we go through those first few, I hear that, you really all want to talk about this, then we can add those in here. We always want to leave some flexibility to make sure we cover things that we might have missed. And then the March webinar is really going to be like what to expect on April 3rd when that launch date happens. What will you see? Will you get an email from us? How will you know? And then also, I'm hoping it'll be an opportunity for security liaisons to ask any questions that they have regarding security as we get ready to potentially add other users or change users. And so we want to have that available. And then I have post-launch webinars for April, May, June, and July just to ensure that we provide you enough support as you start to use the application. And then we will switch to office hours after that. So the training plan, as we are moving forward, if you kind of look to the right of this screen, my tentative is to have mentors begin training after November the 22nd and have the agency staff start no earlier than December 27th. Actually, I'm thinking potentially January, and to the left kind of explains why. So the vendor, FEI Systems, is currently doing regular releases that occur every 2 weeks. So you can see below dates that they're occurring on, and they occur at about 1 p.m. till the end of the day. They're working in UA, in this instance in MTZ, to update the environment. And what they're doing is they're taking those group of defects and changes and they're loading them into the computer application. And our thought is really until this December 27th date, which is kind of one of the last releases, that there will still be some defects that might be problematic for folks, and there really isn't potentially a need for them to start earlier. We're thinking about having mentors start that month before. As you can see, a bunch of changes will have been made, and we could probably let you know what December 5th, December 27th have left for changes to be fixed. So if you run into things, you'll kind of know, but that will give you a chance to refresh yourself and get yourself ready for training your staff again. Code freeze. What does code freeze mean? So what code freeze means for this application is that no further changes are going to occur in the computer application after a specific date. And so this date is January the 31st, 2023. The vendor FEI Systems will lock down the code, which means they won't make any other changes to it. And then they'll start doing the data migration for all of the, data, for all of the documents, for all of the users. They'll start all of that. They'll begin that process. And that's really what they're going to be doing from code freeze to the launch date, is getting all of the data into the application, testing it to make sure it all works well, and then move forward. And then what will happen is after the launch date, after that go live date, a release schedule will resume, and we'll also again start sharing that with you what that release schedule is. If we have an idea on what's going to be done, then we will share that with you as well. We will have an idea, but I just don't know it at present. So we'll share that with you as well. So try not to be ambiguous, but feeling like I just was. So the other part to know is we've talked about that there are assessments and support plan documents that exist in the MnCHOICES assessment and support plan applications. And what will be happening on our side is all documents that are in that complete status since November 2019 will be moved in PDF, and then those PDFs will be attached to the people that they belong to. So you'll have that historical document data, and they'll be loading that as one of the last. They'll be loading that in March of 2023, just so that you know. So I kind of want to show you how the launch details are going to fit together when I think about it. And when I think about expectations, this for me is much more about kind of, as we're doing this part of the webinar, then this is what I think either you'll be able to do or then when we kind of talk through those workflow models, you'll be working in October and sending the onboarding spreadsheets back to us. And then I'm hoping we have given you enough content on what workflow could look like that you'll be able to start working on workflow models for your agency. Then in November, my goal is to do the training plan, talk through the release schedule, look at that current functionality enhancements document so that you kind of know where things sit for you as mentors, and then you can start training kind of and get used to everything that's in there and how it all works so that you're ready to go and prepared. And you've got about a month or more to do that, knowing that we've got holidays in there, right? So trying to give you a little bit of time around holidays to get yourselves reacquainted. Then when we do December, I was thinking about what copies over in the revised MnCHOICES application, if that is indeed something you're interested in, from assessment to assessment, assessment to support plan, HRA to HRA, HRA to support plan, rather than, so that's what I was thinking about for the December topic. And then while that's happening, FEI is going, or the vendor is going to start loading staff data and testing it in the production environment. Then in January, while we're doing that 90-day transition review, conversation timeline, and expectations, on the other side, we're going to see a code freeze happen. So there won't be any more changes to MTZ. There will be no more changes to the production environment they're developing, and your staff should be able to really go in and train using the system as they'll see it when it launches. And then in February 2023, we'll talk about what needs to be talked about. And then we'll have an opportunity to address kind of other training topics and questions that you might have. You might be far enough in with your staff now that there's a bunch of stuff we want to talk about. And so this gives us a chance to do that. I want to make sure we have that kind of open place for us to have discussion. So in March will be what to expect when we launch. Security liaisons will be able to join us and ask questions, and the historical data will be loaded in the MnCHOICES application. Then in April, we'll do a post-launch webinar. We'll talk through, I hope, transfer protocol, and you're going to start transition 1, right? Month 1. So this will be your first month where you'll be finishing up your work in the what we often call the legacy. So either in the assessment support plan applications or on paper. And then in May, again, we'll do another post-launch call that will provide you support, and you'll be in your second month of that transition. And in June, then we'll do another post-launch support call so you can ask questions. You'll be in month 3 of that transition. And then in July, we'll have another post-launch call I'm anticipating that we will stay on track and that the support plan and assessment computer applications may be retired. So that's why you see this here. I'm thinking they'll be retired at that point, and that then the lead agency will all be doing their work in the revised MnCHOICES application. And then August to December, we won't have any more webinars. I assume we'll go to office hours. I know some of you may have questions about Mentor Alliance meetings. I don't have the answers for them yet. We're still really working on trying to get this application launched and you trained. And so I will have more information about that at a future time. So I just want you to know I haven't forgotten about you. And for folks who don't know what a Mentor Alliance meeting is they've been places for MnCHOICES mentors to come to a meeting and we walk through application, talk about defects, work through different topics that mentors would like support on. So we're trying to determine what those meetings could and may look like. And so and what mentor support will look like going into the future with the vendor application. So that is a to be determined. So I want to stop there because boy, I just rocked through a lot of detail and I'm happy to back up. So I am, Alan, going to let you know that at this time, I am open to having questions asked, and my MnCHOICES folks, if people raise their hands, if you want to call on them, then Ellen can unmute them. And so I will just take a moment and stop. I can't see the Q&A because of the way WebEx works on my side as presenter. So
all right, well, first up, let's go with Sarah. Sarah, you're on.
I'm calling from a care management delegate of an MCO, and I'm wondering, is the institutional HRA going to be in MnCHOICES? At last go live, it was not, but just wondering if that is part of this launch. Thank you.
I'm assuming Sue will need to answer, or Deb will need to answer that question.
Deb, you might not need, this is Sue. I don't know. You know, that might be an SMBC thing because they're an institutional SMBC isn't currently required for seniors. And we don't have a separate document for that. So I don't know, Deborah, were you just intending them using the regular HRA for institutional as well? I believe.
This would be for MSHO and MSC Plus.
Oh, well, we don't, there isn't a requirement for an institutional HRA currently.
Okay, each MCO
to be entered into MMIS, and so I think the intent is that there is just one HRA and you would be using that one. But we can get back to you on that.
Yeah.
I'm not quite sure the context. So maybe if you could send more detail about what you're thinking about.
Yeah, I can send it to you, Sue.
Yeah.
Mm-hmm.
Okay, thank you.
And I see that as something that will be addressed as part of the transition conversation as well. So,
correct.
Just so you know.
So that's a good point. Is that there's kind of like a little quarter turn with the HRA that we would be including. Correct.
Yep. So part of those instructions will come with that transition period. We'll give you instructions on what to do and what that looks like. So just so people know that as well. So next question.
All right, next we got Angela. You're up, Angela. Angela Dostal, you're unmuted. All right, let's move on to Cheryl. Cheryl, you're unmuted.
The historical data from the managed care assessment, so we're still using legacy documents and the collaborative care plan. How is that going to be uploaded into the system like the other historical documentation?
I can't speak to that today. Again, that feels like a transition question that we can put in the transition conversation. I have some assumptions about it, but I hate to speak to my assumptions because I do not want to be incorrect with you.
But there will be plenty of time allowed for us to have those documents ready to be uploaded, I'm assuming.
I'm assuming they aren't uploaded. I'm assuming that only the assessment and support plans are uploaded, that you have the paper documents and that you will refer back to them. But that is an assumption on my part, and I don't
okay.
know if anybody on the MCO side wants to speak to that, if my assumption is indeed correct, so that we don't leave her wondering about that.
Hey, Teresa, this is Jill. Yeah, I think that what you're saying is spot on, that it's at this point we're planning MnCHOICES assessments and support plan documents as historical documents to pull over, like legacy documents, paper kind of documents. You know, at this point in time, we're not planning on loading those into the system, though. I mean, kind of a can of worms, but I suppose different agencies could make possibly some decisions about uploading some of those documents themselves. But more to come for sure on historical documents down the road.
Yeah, and so, yeah, and just to be clear, and I think maybe that's confusing with the language that I use. That's why you saw on the slide when I said historical documents, I was speaking to documents that exist in those two applications, because we can capture them, that data, and make them into PDFs. We don't have that opportunity with your paper documents.
Okay, I just wanted to make sure. I just wanted to make
No,
sure
I
there wasn't an
appreciate it.
expectation that we had to send all those somewhere and not
No.
have. Okay, thank you.
Yeah, you're welcome.
All right, great. Let's move on to Jessica Mickelson. You're unmuted.
So I just wanted to confirm, Teresa, you had the slide regarding potential different dates for launch webinars. And when we registered for them in TrainLink, it did give the dates of October 12th, November 9th, and December 14th. So those may change. So we should.
Oh, interesting that it's got no.
Yeah, Jessica, you're correct. I believe that the PowerPoint was incorrect.
Yep, I agree with you that the PowerPoint is incorrect.
They're all on Wednesdays.
Yep,
Yeah,
this one
okay,
should say 9.
TrainLink has.
Yep,
Okay.
it was incorrect.
Teresa,
Thank
you
you
got
for
some
catching
smart
that.
people on here.
I know, I love it that they catch my mistakes. It's
I
awesome,
know.
isn't it?
Should we move on to?
I had 2 questions, if that's okay. We've got staff wondering, for those folks who are Roll 185 who have not had any changes, how will we handle those? Will they need a new MnCHOICES once we launch revision in order for case managers to be able to update their plans, or will the client and their family still be allowed to waive their reassessment?
So again, I'm just gonna say that that will be part of the transition conversation, and I would like to leave it there because I'd like to have us have it all in writing for you and be able to share it with you as one group versus taking the questions one at a time today, because I don't want us to accidentally misspeak or haven't had a chance to think through the conversation. So it's not that I don't think your question is important, because I do. I just want to make sure that we kind of talk through them together as a group in one webinar.
Okay, that makes sense. Thank you.
Yep, you're welcome.
Great, let's move on to Kirsten Rhodes. You're on.
To hopefully provide some maybe clarification to the institutional comment. They're talking, I'm assuming, I guess, maybe skilled nursing facility health risk assessments. Again, I know those aren't a requirement to be entered, say, into MMIS and that type of thing, but there had been discussion in the past in terms of like the MCO requirements of having those and what we would do, and if that would be similar to what you were saying, something post-launch, but that MCOs would need those to continue to be something they do individually. So just maybe clarification to bring back when you guys are discussing that.
Yeah, thank you. Then we can add that to the transition conversation. Yep.
All right, let's move on to Jessica Mickelson. Or do we already go?
You already answered mine.
Sorry about that. We'll lower your hand. How about Linnea Layton? You're on.
I was wondering for.
Linnea, we can hardly hear you. Can you speak up somehow?
Sure. Can you hear me now?
You're very faint.
How about now?
A little better.
Okay. I was wondering for the
Oof. No, we can't hear you a bit.
Linnea, perhaps you could type your question in the Q&A section. Teresa, we don't have any more hands up at the moment.
Okay, we will let her go ahead.
We do have a
Go ahead.
We do have a question from Angela, which she just raised her hand. So maybe we could unmute her too, and she could ask it. But if not, I have it in writing. If she's not able to answer or ask her question, are you there, Angela?
Can you hear me this time?
We can.
We can.
Okay, good deal. I'm just wondering about the people that certified the first time and how that's going to work for training for them this time.
Certified, and when you use that language, what do you mean by
They
that?
completed their training and became certified assessors the first time.
Yes.
And so how is that going to work this time for them?
So there's no reason for them to have to take their certification again. They're now certified assessors. They now follow the recertification requirements that were laid out at the end of their MnCAT training. They took a module on recertification, and they'll follow that recertification process and use the recertification module.
Okay.
So they'll complete their continuing learning credits. They'll put them in TrainLink for the period of time that their certificate is. Then when they have fulfilled that requirement, they'll get issued a new certificate, and then they'll start that process again of completing their continuing learning credits for that next span in their certificate, and they'll just keep going. They'll keep working through the recertification process to keep their skills and their knowledge up to date.
Okay. Thank you.
Yeah, and when you have questions like that, I just want to say too, you can go to TrainLink and take the new mentor training. I think it's like MnCH 9000. And what's lovely about that training, there's one called the MnCHOICES Assessment Mentor module, and in there is all of the kind of the supports you need for getting people certified. And then it also talks about recertification, so that may help you as well as there is a link. I'm going to see if I can get to County Link and bring my screen over. In recertification here, there's something called recertification instructions and guidance. And that's a really decent document for mentors to read. It's readable, it's not terribly long, but it gives you a good overview of recertification and the expectations around it. And I'm right now updating it, so it should be updated in the next couple of weeks to speak more to the revised MnCHOICES application than the current application.
So Teresa, I think part of the confusion wasn't really how to recertify. It was the fact that when they did certify, they were only certified under the new system. They were not allowed to be certified under the old system. So they've pretty much been in limbo here for a year.
Well, so that wasn't the intention of that. If you have assessors in your lead agency, in your county, your tribal nation, because those are really the only two people that would need certification currently in the old system. And the reason for that is because part of MnCAT Step 3 is going into the old system and completing assessments as an active assessor. So for those folks, right, they were certified in the old system because they're using it currently to do assessments. For managed care organization assessors who were certified early because we thought we were going to launch in November, you're right, they are in a holding pattern, but there isn't anything new they need to do except for when they go do their training in the new application to get a better sense of how it's going to work for them in their work, because they did it and they finished their certification in the revised MnCHOICES application in its state that it was at that time, but it's that state has been improving. So they'll want to get updated, make sure they're comfortable with it, know how to use it, know how to take forms offline, for example, things like that. So does that answer your question, or did that just complicate it for you?
No, that answered my question, because we here are combined at Sibley County, and so
Yep.
you know, we kind of have a unique situation where we have current assessors and we have some people that are not in the current system. So
Yeah, and we just, you know, I totally get that, right? If they're a delegate worker, they don't want to be in the old system and learn that system if they're not using it for their managed care work. So yeah, they have to wait, but we haven't changed the certification process for them. Their certificate dates are their certificate dates. They'll need to go through recertification like all your other certified assessors do. So that doesn't change.
okay, sounds good.
Okay.
Thank you.
Yep, thank you. Yep.
Okay, so how can we update an email address for receiving the onboarding spreadsheet?
So what I would recommend that you do is put a help desk form in today and say, hey, we have this person originally submitted it. I need Teresa to send it to this person, and put the subject matter onboarding contact change. Okay. Then the staff will route it to me, and then I will make sure that I send it out to that person instead. I won't send stuff out right away in the morning tomorrow. I could start a little later if you needed me to, so you have a time to go back and say, who was that person? So I could start like 10 o'clock or something, if that would give everybody just a little bit of time. Or if I had sent it out, I could resend it. They'll all get sent encrypted, so everybody knows.
Panelists, were there any questions in the Q&A that didn't get addressed yet? While you're
There
looking,
are a few that were still, yeah, go ahead.
all right, while you're looking,
But
let's
I see
call on
someone raise their hand.
Teresa. Let's call on a different Teresa. You're on.
Do you want to say her last name so she knows it's her?
She doesn't have a last name listed.
Okay.
Teresa. Teresa, what do you think
Looks
about
like
spelling?
Teresa's still muted.
Okay, she should.
There. Okay, sorry. It wasn't letting me click the button for some reason. Sorry about that. I hope I can lower my hand. I'm wondering about computer and tech specifications, if those things are available. I just know, like in St. Louis County, we're talking about replacing out computers. I'm sure others are too. Not everybody, but as we go forward, just making sure that I haven't had any alarms about this, because it seems like it's not, the new program isn't going to be any more unique or difficult to run on, you know, existing software, but just want to make sure that we're aware as we go forward. And my understanding is electronic signatures or in the field signatures are still a no-go. So paper is still how we're going to provide consents and those kinds of things.
So a couple of items. I'll handle the first one, and then Smeeze, if you decide who will handle signatures, that would be great. So on the screen in front of you, I am in the in MnCHOICES County link. I am on the MnCHOICES revision project page. The technical specifications are right here under technical specifications. So you are welcome to click on it and review them and share them with your IT folks. And then regarding electronic signatures, who and Smeeze would like to take that one on? I can speak to support plans having electronic signatures, but I cannot speak to to the whole of it. And do you want to put it on our conversation for review at next one? How would you like to proceed?
Signatures, it really might be better to kind of address that all at once. And so I think that that would be something that might be better for us to wait to answer.
Okay. I will put it on a future webinar. I will look at where it fits the best, just so that we answer it kind of as a whole. So sorry, we're not
Yeah.
sidestepping your question. We just want to make sure we do it thoroughly.
Right. There's just a lot to that we'd want to show you too. So just
Right.
to even how we're saying it, we'd want to show you. So we'll make sure to get that in a future webinar.
And it was on our radar as well. Are there other questions, Alan?
No other hands are raised. There's been a
Okay.
few questions in the Q&A.
Beth, are there any other questions that you need to share, that you guys need to share? Otherwise, I will move on.
Well, I think that somebody would like the help desk link again. Kristen was asking if you could show us that again.
Yeah, so
And
I'm
then,
on County Link. So see, I'm on County Link and I'm on the MnCHOICES. I clicked on the MnCHOICES help desk page. And here's the contact form. Hey Beth, on your side, will you put the link to County Link in the Q&A panel so people have it and they can make sure they have it bookmarked?
I sure will.
Yep. So then what you can do is if you'll click on this help desk form, then it'll come up and you can fill it out. And then as you'll see, so if you want to put on here about onboarding, you can put it, let's have you choose other, because it's not
There's someone wondering, Terry's wondering about if there is supposed to be a subject line in the help desk ticket, like, or what the subject
I
line
know,
would be.
I said that, and then I realized when I looked at it, I don't see it either. I always think it has one, and so then I always tell you to use it, but I don't see one either. So
I
yeah,
think it's
I'm sorry
automated
about.
when they come to
Yeah.
us. They come to us with like a ticket number and it's automated, and we usually end up changing it. So just to help us identify it better.
Yeah, so I think if you just put something as specific as onboarding contact change, it'll help when it comes into the system that the messages come into for them to know who to pull it for. So that way they can send it to me and I can then follow up. Yeah, and I apologize for that. It does not have a subject matter. You're absolutely right. Are there any other questions?
I think we're ready to move
No,
on.
not at the time. I think you're okay. Yeah.
Okay, so let's go ahead and keep going. So onboarding, kind of the process of loading your users into an application. I thought this picture was a fun way of showing it. This is the swing bridge on the St. Croix River going from Hudson to the Stillwater area, and it's what allows the trains to go over the river. And so many boats have to have the bridge open so they can come through. So I thought it was kind of a good analogy for onboarding. So like you heard me say, when I use the word onboarding, I'm talking about a process of collecting your agency, the lead agency staff. So lead agencies will collect all the delegate and contracted agency users, and they will as one big batch into the application. What we're going to do is we're going to send you updated onboarding spreadsheets only to the lead agency contact who put in the form or that your lead agency says send it to this group. And I'll talk about what that data will look like in just a minute. And then we'll send it to you tomorrow. We'll ask for it back pretty fast turnaround, October the 3rd. And the reason for that is we have a deadline on when we have to have the data all cleaned up and prepared and ready for the vendor. And this allows us to meet it. And so that's how the dates, both when it got sent to you and when it needs to be returned, were determined. So we updated the onboarding sheets. So we took your original sheets. We've been hanging on to them, waiting to go ahead and load them. And you've been asking us questions about when do we get to verify and look at who we said had access and how do we make changes. And what we decided we were going to do is send you the sheet back. But we did some things to make it, we think, easier for you. So we took off unnecessary columns that didn't really make sense and had you stuck asking questions, so we removed them. We decided, yeah, let's send it to the member who completed it last, because that way we don't have the confusion of sending it to all the mentors and having you be, gosh, I wish you wouldn't have done that. We would have really preferred you send it to this person. So we were trying to eliminate that. Then we added a few columns. We added one called, I'll have to make sure this is still correct. We've been working on these spreadsheets. We have one for sure for so for action, active, and grant access, and I'll look at the instructions with you, the actual instructions, so we can see if I have those right or if they've changed. And then the vendor required that we also add gender to the data as well. So you'll see that column has been added. So what your onboarding sheets are going to include is all the users you gave us from before when you returned it the last time. And in addition, we had our database team scrub the MnCHOICES assessment and MnCHOICES support plan databases for users who were added after your last sheets. And so we added those people to the spreadsheets as well. We're hoping that that will improve your process, help you hit this tight timeline better. And really the sheets back to you are your chance to verify and remove access, add staff to the spreadsheet, and make changes when you look at it. Like, nope, that's not right. It should be this. Or, you know, our email addresses changed how they're read at the end. And so we need to go through and change them to gov instead of whatever else they were. So it gives you a chance to kind of go through your data and make sure it's correct. And to add people if they're not there at all and you need to add them. Because for managed care, you're probably going to have to add more staff than other folks because we do have they were added to the system data. So I just want people aware of what you'll be collecting and doing. So the action column is kind of the first column. And like I said, I'll show you the instructions. You're going to get a data sheet and you're going to get a separate instruction sheet. And we separated them because we thought that way you could have one open on one screen, one open on the other, and then you could work back and forth and it would be better for you. Or you could print the instructions out and look at them while you were working through it. However you want to do that is up to you, but we just are trying to make this as streamlined as possible. So the instructions are going to do just like it shows here. They're going to tell you, hey, it was pre-filled this way. Here's your options to choose from to change the data for that person. I've changed them, so I need to give them a C. Nope, they need to be deleted because they're not here anymore. I added some data to the spreadsheet and I want you to, so that way we know that it needs to be updated. If you say see new pre-filled, it's because it's telling you we've pulled the data from those two computer applications and we just want you to check it. And then if it looks good and if it's correct, then it'll be good to go, but we just want you to be aware of it. And then you're going to see, whoops, I didn't mean to do that. Then you're, sorry, I'm going to try to do this again. I was just trying to highlight this one, but I guess I can't. So I'm just going to circle it, circle it, circle it. So grant access, you're going to see that. And what you need to do is tell us yes or no, this person should have access. It will be pre-filled to yes. When you change it to no, then you should There will also be a section at the very end called Data Privacy Complete. And what it will do is either it'll be complete or blank, okay? If it's complete, then that means your folks have all the data privacy coursework they need done as of 9/1/2022, and they're good to go. If it's blank, that means you need to go and look at that person's handling Minnesota information securely data privacy coursework and have them complete what isn't done so that we can load them. Because if it remains blank and they don't have it done, then we can't load them into the system. This is our opportunity one more time to say, yep, they've taken their data privacy course. Yes, they can have access to the system. I am asking that the spreadsheet have the choice done on it. So you will then move that blank to done. I will know that they're complete, and then we're required for those to go into Handling Minnesota ourselves and check them to prove that they indeed are done, that DHS has said, yep, they're finished. So I just want you to be aware of that last column because it will affect user access, and you then may have a back and forth with me as I work to try to help you get that done. And I'm just going to show you this because I think sometimes this helps people. When you're in Handling Minnesota Information Securely site and you're in the user management screen, I would expect to see that the user has the training role county worker. If they don't have the role county worker, they're not going to have the right number of data privacy coursework that is required, which is what shows here. And then you'll get an email back from me that says, I fixed the training role, have them take the remaining that are left. And to reduce that back and forth between the two of us, when you see complete, and it'll be an empty box, it won't be X'd, and they should be able to go in and take it then. It should show up for them. The other thing you can do is if the person doesn't have their X1 or PW employee ID in their record, having that updated too makes it easier to find people. And then after you've reviewed the sheet and the instructions and have made the changes, we will have you send them back to us. If there are no changes, if you're an agency that hasn't seen any changes, I still want you to send the sheet back to us and indicate when in the email that there were no changes in the sheet. That is our way of verifying that yes, you're saying go ahead and load these users. So just so you're aware of that. And then again, they'll be due back the 3rd, and in your message you will see in your message, you will see the, you'll see who to send it back to. Sorry, I was distracted by the message at the top of corner of my screen. So let's go ahead and go. So some frequently asked questions that you're going to have about this onboarding sheet that I'm anticipating. So if active is marked no in the sheet, but I want access to the user, what I want that user to have access, you'll change it to yes. It may be no because they're showing inactive, and so we will have moved them to no, but you can mark them yes again. And then sometimes people have the question about which job title do I use, especially if you're wearing like 3 hats, right? You're a certified assessor, you're an assessor certified supervisor, and you're a mentor. I want you to choose mentor, okay? If you're a mentor, I would like your job title to be mentor. And the reason for that is we're creating a report, or not a report, yeah, I guess so. A report in the application so that you should be able to pull out the mentor list for other agencies as well as yourself, and we'll be able to use it. So it will be useful to have it as your mentors show up as mentor for their job title. And then who should have the role MICP was a conversation we had a lot last time we did this. And I would just say this, indicate at least one person who you want to have that role if you need to transfer cases or coordinate CFR and COR. And then you can always change them yourselves inside the system once you've figured out kind of what you want to do, but at least indicate one so that when we get to the place where you've launched and you really are ready to use it, you've got someone for a contact. And what MICP means, sorry folks, is MnCHOICES Interagency Contact Point. So what it is for your agency, it is the person who will get a notification that a person is being transferred to your agency, and then they can then determine in your agency where that assessment or case or person goes, whatever that looks like. And so that's its purpose. So another question that was asked is in the past is for the role care coordinator, should they also have a certified assessor role? And if you're a care coordinator for MSHO and MSC Plus, you should also have the certified assessor role, not for SNBC. SNBC care coordinators don't need to be, aren't a certified assessor, won't be using the MnCHOICES assessment. So it's only for MSHO and MSC Plus. And then who needs a TrainLink ID? If the person's role is certified assessor, they must have a TrainLink ID because all of the certification credentials are loaded from TrainLink to the MnCHOICES database, and they'll affect their access for completing a MnCHOICES form, assessment form. And so if they're a certified assessor, they need a TrainLink ID. The form itself will require it. It'll come up red. And I'm going to show you the instructions. Whoops, sorry. Quick. This is the rough draft of them. We're still finishing the last details of things I've noticed that I want a little bit different. And so you're going to get instructions that look like this, and they'll, for every single column, they'll tell you what it means and what you can pick and provide you instructions. So they're all in here. And they'll tell you if it's optional, like you'll see there's one that I just saw where it'll say this data is optional. If they're required, it will show up red. So again, we chose to send these by themselves to make it easier for you to use them. And for each of the roles, it explains what that role means and what that role has access to help you understand it a bit better. So I think that's helpful as well. And then it'll have who to send it back to. Talks a little bit about the data privacy and when it's due back. So I'm going to leave it at that, and I am going to give us time for questions.
Great. Let's start with Annie. You're up. Sorry, one moment. Go ahead, Annie.
Brown County. I'm just wondering the purpose of identifying a single person for the interagency contact point.
It can be more than one person. For me, it's just more about making sure there is one because we currently have, you know, that MICP list out there that's got the general email address.
Yeah.
And so it's going to, I'm hoping that when this all gets said and done, that internally the system will handle it itself. And it's one of the pieces I'd like to discuss at a future webinar. I'm hoping it'll happen at the transfer webinar in the summer of next year or in the spring of next year to talk about how to use it. So you don't have to have the perfect person or the solution for it, but at least if you pick one, then when we have that conversation, you can think about how to use it and how to move forward with it.
Okay, because we have a contact point, but not a person. So I'm
right.
Sure
Nope.
Okay.
Yeah, I totally get that because what it's going to take us down the path on, which is why I just said it that vague now, is we're going to talk about how to use that role, how to set up notification, what that could look like for your agency for workflow, if you would use a specific functionality in the system and what that would look like. And we're not ready to have that conversation. So my thought is if you pick one, then at least we're set to have that conversation and you can change it. I mean, that's the beauty of this, right? You have access to the system so you can decide what you want to do, but it would at least mean you have something set up. But again, that could be your choice. You could say, no, we're not going to do any MICP now until we know more. So that's only my suggestion. No more, no less. You could choose to do more. You could have 4.
Great. Let's move on to Kelsey Peters. Go ahead.
I just have a question in regards to managed care enrollment. How would you list on that onboarding sheet who would receive new enrollment for managed care?
Enrollments are not a part of this piece, but I don't know, MCO folks, if you want to talk about that from the enrollment sheet idea. Because I think that system has all been set up and in place and worked through separate of this, but I can't speak to it. I feel like I'm just talking in the dark.
Is she asking about, this is Sue Kavenju, when there's new people who are new enrollees to their health plans? Is that what you're asking? Yeah, that's a separate system. You get that information through the current system.
And you're saying that won't change, Sue?
No. MnCHOICES, you know, because many people get enrolled in managed care that have nothing to do with MnCHOICES, if I'm understanding the question correctly. And then, you know, health plans have ways of letting their care systems and their delegates know who is who's been assigned to them. Unless I'm misunderstanding the question about that, but, and Deborah, I don't know if there's anything different you would add to that. You might be double muted. We can't hear you.
And do you feel like that Sue answered that question for you? She may have left already. Okay, I'm going to go ahead and let us go ahead and answer the next question, please.
All right, let's go to Kirsten Rhodes.
Hello. So I had a couple of questions actually. So one being, so at South Country as an MCO, we have a couple of contact people. Teresa, I was trying to garner if I could get the answer from your last response, but for MC or MICP, would we be able to put, are we able to have multiple roles?
Yes.
Should we put
yes.
mental and MICP? Okay. Yep. That was one question. Okay. Yep. And then I guess I wanted to make the comment, make sure it wasn't kind of forgotten about because it's been quite some time, but for smaller rural MCOs, we do have care coordinators in the SNBC group who also are going to be certified assessors because they wear the same hat. And so I just want to reiterate that. And how would those be listed?
So again, I think, so what you're saying is when I look at the sheet, I could be seeing as a DHS person reviewing data, I could be seeing something that shows care coordinator SNBC, and I will see them having a certified assessor role. And I shouldn't remove that because that's correct for your agency is what you're saying.
Yes.
Okay. I heard you loud and clear.
All right.
You can also, if you want to, put that in an email when you send the document back.
Okay. Okay.
Just acknowledge the obvious, right?
Yeah.
Thank you.
And I think that was it. Thank you.
Okay. Yep. Thank you.
Great, let's move on to Jeannie. I hope I'm saying your name right. You're unmuted.
Oh, can you hear me?
We can.
All right. Hi, Teresa. So we have a newer staff that's not going to be able to be certified until after the launch, but she is going to be working in the support plan. So I'm assuming we would just add her to the onboarding sheet as a case manager.
Correct. And then what you can do is when she indeed is certified, then you can go into have your person who's doing your access go in and add her role as certified assessor. And then when her train link data comes over after what'll happen is she'll take her MnCHOICES certified assessor training, and when she's gotten her certificate, it will generate dates, and that will go into a database and it will automatically update the MnCHOICES application. And so you'll see that her credentials, it's in the credentials section of her profile, it'll show that certification is sitting there, and then she'll be able to be a certified assessor with that role and have access.
Okay, and then I guess one more question. I also have another newer staff who is able to be certified, and we are doing the lab with her on the 29th of this month.
Yep.
So I can list her as an assessor then. I
Yep.
mean, even if I turn it in sooner than the 29th?
Yeah, I think it's a good question. If you are anticipating someone will have their certification done by launch, yeah, you should probably mark them as certified assessor. Because if they have the role certified assessor but credentials aren't done, then they will show as lapsed and they will only be able to view a MnCHOICES assessment. So the application will manage that. But I would say if you are confident that that person is going to be a certified assessor by launch, put them in, give them the certified assessor role. That's what I hear you asking, correct?
Correct, yep.
Okay.
All right, sounds good. Thank you.
Yep, you're welcome.
Great. Okay, Kathy, you are unmuted.
Kathy, are you there?
Oh, hello. Sorry about that.
That's okay.
How are you? Say, I am looking at slide 25 and I have a question about the data privacy complete. And I just felt a little confused about this portion of it. So, because there is this gap in time between when the spreadsheet is submitted and when the application goes live, what's the criteria for when we say that somebody is up to date? Because they might be up to date at the time that the spreadsheet is submitted, and we're just going to assume that they're going to stay up to date.
Right, correct. If a staff person has the word complete in that column, you don't even have to think about them. Okay, because the SAM team has actually went through and reviewed their data privacy coursework and marked them complete if they can see they're complete. They have this automated system and they put all that information in the data for us. So that was awesome. So really the only one you need to worry about is blank, because blank means they're not current as of 9/1. That's when they ran the data verification.
Okay.
So it should make it pretty easy for you. You should only have to deal with the blank ones, and hopefully there aren't many of them. And those are the only ones that just need to get their stuff up to date.
Oh, outstanding. I get it now. Thank you very much.
Yep, you're welcome. We tried to make it easier as much as possible, so we have a little back and forth and you don't have to do so much work.
Yay.
Wonderful. Let's move on to Annie Braun. You are unmuted.
Hi, sorry, another question from Brown County. I just wanted to touch on Kirsten's question about when you have people who are assessors and then also SMBC care coordinators. So how should we be handling onboarding when, so the county is getting onboarding sheets and then the MCO is getting onboarding sheets? Does it matter to you if there's duplications there? So if the county is completing an onboarding sheet and saying this individual has a role as an assessor and a case manager and a care coordinator, and then the MCO also submits an onboarding sheet that says they're a care coordinator, does that matter to DHS?
So how it'll be done, and this is always a tricky one for counties who are delegates. So it's a very good question, and I'm glad you brought it up here. If you're a delegate, your staff access will show up in the MCO and not on your spreadsheet. Because when you're doing your county spreadsheet, you're the county, you're the lead agency. And so only the users who work for your county as county staff doing county work will be there. The rest of your delegate staff will show up in the lead agencies that you work with. And I think what you need to do is speak with and the MCOs would need to think about this too, is how to update those. Because they're really only going to need updates and not potentially a bunch of ads, you could do it a bunch of different ways. They could send their information back out to you and have you verify. You could say nothing has changed with us to those MCOs, or you could do some combination of a video conference call where you look at it together and update it and be done with it. So that's really up to you, but the delegate staff will be in the MCO's spreadsheet and they will have to determine how to update those, and you can work with them to figure that out. But I don't want to see them in your county spreadsheets because that will, then we'll see duplicates, which will then we'll have to delete them all out. But
So we will have staff that they are delegates and then also do.
yeah, and we expect to see that when we
Okay.
combine the data. We'll expect for your spreadsheet that you'll just do your county staff, and we won't see any locations that are like Brown County Blue Plus. We won't see those in your spreadsheet. They won't exist there. They'll
Okay.
exist in the Blue Plus spreadsheet as Brown County Blue Plus. And then what'll happen is we'll take all your data and put it together, and we'll expect to see that you may have a staff person who works for your county and 2 different MCOs, and we expect to see that. That's just, we're used to seeing it. We understand what it means.
Okay. And then I just had one more question, if I may, about what happens with, so if you have new people who are falling in between the time that the onboarding spreadsheet is due and the launch date, and they're getting certified within that time frame, how do we get them added?
So your point being is you send in your onboarding sheet already and now you have new staff. Is that correct?
Correct.
Okay. So then what will happen is that you will add them into the system once you have access for that go live date. Anytime after that, your security liaison will be able to add staff, and the SAM team will be able to activate accounts, and we can do that as part of that conversation. You know how on the slide I said will be a good time to have a conversation with security liaisons? That will be part of that conversation. Okay. How to add new staff into the system. What does that look like? Having them learn how to use the smart guide and the SAM request form to do for revised MnCHOICES application, but they'll add them directly into the system.
But these would be people who are going to be trained in the old system, because we need them to be able to do MnCHOICES even before the new system rolls out.
Right. So what you're saying, and again, let me try to repeat it and you see if I have it right, okay?
Yep.
So in this instance, you have staff who are working in the MnCHOICES assessment and potentially the support plan. Those you will do the way that you currently do them. So if they're MnCHOICES assessment in your Brown County, you'll put them through your SSIS administrator. For support plan, your security liaison will put in a ticket to the SAM team to give them support plan access. Then when they need to be in the revised MnCHOICES application, you'll add them in. You'll maybe start keeping a list of people that need to be added into the system. Is that at all helpful? Does that answer your question?
So they'll go through the normal process of getting certified and getting access to our current system, and then there's going to be a different way for us to add them when the new system rolls out in April. That's not through the onboarding process.
Correct, because
Okay.
one of the lovely things about this system is that you'll be able to add and manage your own staff access.
Okay.
Okay.
Thanks.
Yeah, you're welcome.
All right, let's move on to Leah. You are unmuted.
Yes, my question is going to go back to the MICP. It's just, I guess it's really not a question. It's more of a, I just want to throw it out there so people are aware. But as a service hub in Kandiwai County, it's very common for us to have the case manager that referred a case for reassessment no longer be the case or be the case manager anymore. So I would highly recommend a way for the MICP to be a generic contact, not individually named people. Whether you have 4 or 10 people, it's too much to follow through. So I just want to make that as a statement.
Yeah, Leah, it is something that we are aware of, and we are looking at it as we think through transfer, because it always has been generic in the past, which is kind of why you hear me not talking about it in any great depth, but just asking you to pick a person, because there's going to be a way to do it that we're working through. We just don't have the answer yet because we're working through the functionality with the system as it continues to have releases. So we'll have a solution I hope when we get there.
That sounds
But for
good.
right
Like I
now,
said,
I
I
just
wasn't
want to,
expecting
right.
an answer. I just wanted to throw it out there.
Yep. We expect that you're going to have a neutral place where the transfer goes to, and then on your side that someone will answer that neutral place and then figure out what to do with people. Yep,
Right.
that's what we
Okay.
expect. Mm-hmm.
Thank you so much.
Let's
You're welcome.
do one more question with Kirsten. You are unmuted.
So I'm going to start with my MICP question and kind of clarify as well. I clicked on the link that was dropped. Thank you. It looks like interagency there is only referring to counties and not MCOs.
But
Are
it will,
MCOs also?
yep,
Okay.
MCOs will need them also. And like I said,
Okay.
we'll have more conversation about this later as we get
Okay.
closer. I just want you to pick one so that when we get there, you aren't like, dang, I wish we would have one of them already done.
Okay, good. I just wanted to clarify that piece because I was looking and going, I'm not seeing any of us. Okay. The other thing is I think I'm really on the same board as where Annie was, and she's one of our delegates, so it makes sense. But my question was going to be, we're up. It seems like we're doing the onboarding very early if we're not launching until April. And so I just wanted to, I guess, maybe make a comment on that, like that we aren't then going to actually be able to get anybody from October through April entered any other way until once launch happens. Is that correct? That seems a long time.
It is, and I asked the why for you, so you know that, because it feels a little, feels long, right? But that's a reasonable thing to think about. But it really is about, we'll get the data ready on our side, they will load it, and then what's going to happen is then it starts to be tested. And you have to think about this as the whole system. Basically from, I'm going to say, when your data gets loaded at the end of the year, and all of the other data, right? Person data, historical documents, all that stuff gets loaded. It all has to be integrated together, and they have to have time to test it. So they really need 3 solid months to make sure it all is working as it needs to. It feels early, I get that, but it was the best we can do. The lovely part is we have this transition period of time, so that you'll have from launch, a few weeks to get people in and work with your security liaisons and figure out how to do it. It's not perfect, but it is the best that we were able to do, knowing the requirements of standing up the system.
Okay, so I'm going to pose this, and maybe then it's already been answered based on your questions to those who you asked that question to. So we have turnover in counties, right? And MCOs. And so that's why I'm looking at that timeline. It's a very long timeline. So if we have a senior care coordinator and they are coming in and would not typically need to be in the current application and support plan because it's only being required in the new MnCHOICES revision for seniors to be certified assessor, senior care coordinators to be certified assessors. Are they not able then to have any training or anything in MTZ until after launch?
No.
Okay.
Think about it, right? It's been a while since we've all been through the training process we did almost a year ago, right? And we'll go there again. That's why you saw the one webinar is on training. And I'll remind you, like, okay, you have all these usernames that you gave out. People will have taken their access navigation, their content and workflow training, like how do you want to proceed, knowing that there have been some changes to those modules, and we'll give you a list of dates and changes that have been made. And so from there, then you'll decide, okay, how are we training folks going forward with access into the training zone, and what does that look like? So no, you will have your usernames and your MTZ access and your passwords and be able to go out and have people practice.
Gotcha. That makes more, I'm reminded of that. Okay. And so then
no, that's okay. Yeah, it's been a while.
So timeline for then, upon launch, and this is maybe, again, really, really early to ask this question, but there are going to be a lot of staff at SAM on April 3rd for those updates to go timely so that HRAs can be completed for new enrollees that month.
Yep. I understand that as well. I am aware of what that means.
Yeah.
We have been asking those kinds of questions.
Great.
Panelists, are there any questions in the Q&A that you would like to address? Otherwise, there's no more hands raised.
We do have a couple. Teresa, related to the published DHS Excel list of certified assessors, we've noticed a few of our assessors have an incorrect employer listed. How do we get that corrected?
For that, you can submit a help desk form and just in that help desk form, choose other, and in the question, what do I need to know? Put in there the person's name, what they're employed by is currently listed with, and ask for it to be changed. And then I will update it the next time we publish the list, which should be October.
Okay. Can you show us how to verify data security handling courses?
I'll even show you if you want to see it. Let me get... The issue that I'm going to have is I'm going to end up... Okay, I have to think about this. I think what I'm going to do is I'm going to log in, I will show it to you, and then I will show you my record, which won't make any sense because I take my courses in TrainLink and not in Handling Minnesota, so I have to think about this for a minute. Okay, I'm going to just go stick it over on the other screen and log in.
Okay. While you're doing that, I can go on to another question. I can answer this next question about more than one person on the MICP contact list. And I think that we addressed that by saying it might be better to not have it be a specific person, but have it be a group. So Angela, I want to make sure that we got to your question.
Yeah, I think the tricky piece is going to be right now they have a email that's general that they use. And would they give a staff person that general email? And then what issue does that cause if they need to get other information? And so part of it is wearing your old hat and thinking about it in your old hat instead of wearing your new hat. And what it comes down to when I think about it is if you wear your new hat, you could create a group of people who review MICP, but you figure out a way to do it as a potentially as what I'll call a pool. And I think that's beyond your understanding of the application currently. And I think it's overthinking it. So I think the best you can do is just mark the person with an email as the role. And then when we get there, there's plenty of room to think about it after we've kind of set it up, taught you how it could look and what it could be like. And then you could decide for your agency. So don't overthink it right now, old to new. Just give me one person or a group of people who normally do it, and then we can talk about what that looks like from functionality in the system to answer your question about the having a neutral email. Okay. So I am a handling information securely administrator, and what you can currently see is when I log in, it brings up my record and says if I have things done, and you can see I have the required. I could use the user search reporting below and search for a person. I'll search for myself. But you can also, if you're an administrator, search for other people. Then click on the person's record and then look at it specific. So that's when you get the screenshot so you can see, right? Here's all the required. I haven't passed them. My next assessment is due today, and this isn't accurate, but at least you can get a sense of it so you can search for people. If you haven't set up an administrator before, then let me see if I can show you how to do that. Um,
That was the next question.
yeah, you can, if I go to the home, I think I have to log out so you can see it. You should be able to, you haven't logged in yet, you can register and then you can specifically ask for admin rights to it. There's also this email number on the bottom. I would email it and say, hey, I need to be an administrator for my lead agency or for my agency, and they can set you up. And do folks need the Handling Minnesota link put in the chat? Do you need this put in the chat?
I would guess that they would type in that they would like the link.
I know, I was trying to figure out if I could get to it. I think I could send it to you, Beth, through chat, and then you could, I think I can do it. You could send it to them. It's going to send it just as a little blue thing with the name on it. So, but see if that works. I sent it through Teams chat.
Yep.
Okay.
Okay. I will work on putting the link in. I have another question. What if someone has 2 employers for TrainLink, and they would they put that in the help desk form? They both need certification. I'm not sure if we need more information there, or if that's clear.
Yeah. So if you're, when I think of that situation where they would have 2 employers, whether it's delegate or contracted or something like that, right? What'll happen is if you're talking about Handling Minnesota, it has your name, it has your ID, your PW, or your X number, and you'll have given it an email address, whatever that email address is. And it just looks for you as a person. It doesn't look for you I mean, it may last name, first name and last name, and maybe your X or PW number if I knew it to find you. And so that's more important than the other stuff. It doesn't get in the way of the record keeping from the system standpoint.
Okay, I think just a couple more questions, Teresa. What do we do if we need more user numbers for MTZ in a specific category? We have many numbers that are just for assessors, and we only have a few folks that are just assessors.
Yeah, what we'll do is
we'll use nearly all our folks.
Yeah, what we'll do is we'll teach you in training how to change your user roles. When we do that training plan piece, we'll teach you how to do it because you can assign other user roles to your MTZ training to their usernames. So we'll teach you how to change their training roles.
Okay, Teresa, I think we've gotten through all the Q&A questions and there's nobody waiting.
Yeah, and I'm sorry that I didn't catch that the webinar dates were wrong. I should know better. I should just only use October, November, December, and not think that I looked at my calendar well. That's unfortunate. But yeah, so I was going to go back to that. You know what? This is going to take forever to do it that way. I'm going to just go back to that date just to give you a sense of when we're talking about training, because to kind of answer that question about when will we have conversation about MTZ and getting into training. I'm thinking about having that conversation with you in November, and I had the date wrong. So I have the date as November 11th, but it was actually be the 9th. I have to make sure it's not Veterans Day. If it does, I have to reschedule it. If it is, I'll have to reschedule it. But the goal will be to get you in early, teach you about the training plan, teach you some of those things like as if you have the lead agency supervisor role, you'll be able to assign and change some of that access easily enough across your users. And so I can teach you how to do that as part of that plan. And we'll go over.
Veterans Day is on Friday, the 11th.
Okay, so cool. So it should be November the 9th, the second Wednesday. So, okay. Teresa's just got it goofed up. Thanks, Alan, very much.
Sure.
So that's when we'll have that conversation, is that November 9th webinar. We'll go over all of that stuff to remind you, and then you'll get to practice it yourself and get comfortable with it before you have your users in it. So goal is to give you some time. And I've added it to my notes to make sure that this includes reviewing MTZ and roles. Where to find the URL, where your user names are, you know, like all of those basics. We'll just go back and do those basics again, because it's been a while. Any other questions?
Not at this time.
Okay. I'm going to give you just a moment to make sure there aren't any others, because we also have a poll that we need to do. And so I'm going to try to move to that poll. From current slide.
And Teresa, we'll use the Q&A for the polling function.
Okay, so we can talk about it. So one of the things that we find ourselves wondering about when we talk about how functionality should work, how, you know, just when we're having our conversation about what you have available to you to kind of understand how you do your work, one of the items comes up is about this. So kind of in your office setting, whether at work or at home, we want a sense of how many screens you're using to complete your work. Are you using just your laptop? Do you have your plug-in monitor that's plugged into your laptop, but it's still only one screen? Are you using two screens, so you have your laptop and a monitor? Or do you have two monitors and your laptop's closed, and so you're using them? Or some other combination? And what we'd like you to do, if you could, and it'll be a lot of people, I think, but I'll figure out how to collect it after this, Alan, is if you would put like Q1 and then put the answer to Q1 in the chat, and then put in Q2, and is this true of most of your agency staff as well, yes or no? And then I'll figure out a way to compile it. But this will help us kind of know what your work looks like for you, to make sure that we provide good instructions and understand. And I realize you're only representing one person in all of your staff, and so it might be different across staff. But at least it gives us a small straw poll survey.
Yeah, Ellen did add in letters. So the first answer is A, B, C, D, E.
Well, I think what we're getting right here is great.
Okay.
Yeah.
Just say what you got.
The information's
yeah,
awesome.
just say what you got,
thanks.
so we don't have to wonder. That would be great. And I'm going to make sure you have enough time to do that too. But thanks very much for providing us this.
Thank you.
This will help us answer some questions that we're having about what your work looks like for you. And we know you're not everyone, but at least it gives us a good sense. So I'm just going to give you just a few more minutes, but I really want to say thank you to each of you for coming and being present today and asking really good questions and being all right with us saying, you know, hey, we need to wait so that we can answer that question more thoroughly. We are excited about this launch, like you, anticipating it and wanting to make sure everything is kind of in order and well done. And so we appreciate your patience with us as we continue to work through those and get all of those questions in place in an order that we think will help you understand it. Not give it to you so early when you're not ready to kind of understand the application well enough to talk about it. And so We're just trying to be respectful of your processes, and we really appreciate that you're just asking those questions so we can figure out where we need to put them in the conversation. So keep asking them, and don't mind if we tell you, yep, we'll talk about that and we'll add it to our list. Because when I'm done today, I have PowerPoints laid out for all the way till April, and I'll just start popping these in, all your questions in where we'll be talking about them. So it's really very much appreciated that you're asking them. Oh, and then the other thing that I was going to show you too is I'm going to go to MnCHOICES County Link a minute, and I'm going to take you to the MnCHOICES revision project. There is a place, oh, where is that? Submit your launch questions. If you all of a sudden leave today and you go like, oh, I have a launch question, I'm going to start pulling these again 2 weeks before the next launch. So if you have a launch question, you can always put it in the survey and then they come to me. I compile them as a whole group and then I review them. So you're welcome to use that too. That's a way to make sure you quick ask a question when you're thinking about it and you don't have to hang on to it and wonder about what's happening to it, and then we can cover it at a webinar. So I am assuming we have collected answers from everyone and we are good to complete this call, but I just want to make sure that that assumption is correct and that there isn't anything else we need to do. So this is where you'll find the past webinars at the Disability Services Archive. You'll click on MnCHOICES and then it will show you the saved PowerPoint and the recording. You may have to wait a few days before this is in place. We've had some changeovers in staff at DHS, which means access and requests are taking a little bit different timeline than they have in the past. So please be patient with that changeover, but they are and will be available there. And then I just left these key terms in the back of this PowerPoint so that if you ever need to go back to them, there are just some key pieces of language that you might want for kind of like the table of contents or definitions page. And so that's why these are here. No more than that, just reference points for you. So with that, unless somebody else sees questions or sees we need to do something, I would go ahead and close today's conversation. Is there anything else, Alan or Beth, that we need to talk about today? Any hands up or any questions?
Not that I see.
We're good to go.
Then I will go ahead and end today's call. I will talk to you in a month. Thank you very much. You will see onboarding spreadsheets coming from me tomorrow, and they will come directly from my email. It's really the best way to do it on our side that we can determine. So that person who is the contact will be receiving them, and if you email me and give me another, then I will make those updates to the sheets and send them to you. So thanks very much. You guys have a really good rest of your day today, and I look forward to future conversations. So we'll talk to you a little soon, and thank you for coming today.